Hello, my name is Julia,
And I'm Dallas.
and we would like to talk to you today about all the havoc that sugar can run in your body. So, we'll discuss how sugar crystals travel and cause damage in the body. We'll discuss the different areas that high blood sugar can affect, and we'll review ways you and your doctor can work together to recognize issues early. So when you think blood sugar, you have to actually think just that. It is actual sugar crystals in your bloodstream. The sugar that you ingest gets broken down and it makes its way to your bloodstream and it becomes super teeny tiny. And when you have high blood sugar, it can accumulate in the blood and work its way to tiny vessels and cause damage. Here we've included kind of a description, a visual description of what we're talking about. So hypoglycemia, which is just low blood sugar, so when you don't have enough sugar for your body to use. Normal blood sugar is just the right amount that your body needs to keep functioning. And then when you have high blood sugar or hyperglycemia, it's just a lot of sugar everywhere. So how small are these vessels that we're talking about? When blood leaves your body, it's in larger vessels, but the further away from the heart it gets, the smaller your vessels get. So in your hands and feet and your eyes, the vessels are so small, it's almost immeasurable. One way that some patients like to monitor their blood sugar is to use a continuous glucose monitor or a CGM. These are used, you can check at any point in the day, and it's used to reduce the amount of finger pricks for patients. It's useful to see how specific foods and different exercises can affect your blood sugar levels. If you're interested in a CGM device, you can talk to your pharmacist. So we have a question for you just to think about. When is the best time to check your blood sugar throughout the day? It's good to check your blood sugar every day, at least once a day. Definitely in the morning before your first meal of the day is a great baseline that you could use. And then if you want to check after a meal, it's best to check at least 2 hours after to see how your blood sugar levels have leveled out after a meal.
So first, we're going to start talking about cerebrovascular disease. In short, brain or cerebro means brain, and then vascular means vascular or vessels. So it refers to a group of conditions that affect the blood flow and blood vessels in the brain. So high sugar levels can increase the chances of developing dementia. That's why sometimes you feel like you have brain fog. And then also it increases the risk of having a stroke, which we'll talk more about when we talk about the cardiovascular portion. But it is very important to have steady blood flow and good blood flow to your brain. So we obviously don't want high blood sugar for those reasons. So next is vision. So if you don't take care of your eyes, so sugar can affect the tiny vessels in your eyes, and that can eventually lead to vision loss, which is also called diabetic retinopathy, which is the most common cause of vision loss in diabetes. 1 in 3 people with diabetes who are older than 40 already show signs and symptoms of this. So that's why it's recommended to do dilated eye exams at least once a year. And then once your vision can start to improve once your blood sugar and A1C improve. It's one of the first things that diabetics notice whenever they have started to improve their sugars, is that their vision starts to come back and they can go down in prescription. And so next is hearing. So sugar can also affect the tiny vessels and nerves inside of the inner ear. So hearing loss can also cause balance problems, which increases the risk of falls. And hearing loss is twice as common in people with diabetes, and even pre-diabetes have 30% higher rates of hearing loss, which is like something that you don't really think about whenever it comes to diabetes. Hearing exams are recommended yearly, which is also something that's not as common, but you do, if you're starting to feel like you're losing your hearing, it's not just old age. Some of it could be associated with getting older and you losing some of the hearing, but also your sugar levels can affect that. And as we all know, hearing loss is irreversible. So the sooner we can stop it, the better. And next is oral health. So if your blood sugar is high, the sugar in your saliva is also going to be high. And so bacteria loves sugar. It uses it as food. So it can create like an acid-like environment for your teeth. And so that bacteria can cause tooth decay, cavities, and even gum disease. And if it's not treated, then you can actually lose teeth. So diabetes can affect your oral health. You'll sometimes have less saliva, causing dry mouth, gums being inflamed and bleeding often, and then infections in your mouth can actually take longer to heal. That's why regular dental appointments are very important to help prevent problems. And then also you need to brush your teeth twice a day at least, and then floss them at least once a day. Then also either quit smoking or don't ever start, because it does increase your risk of gum disease as well as worsening your diabetes. So we have a question for you. So how often should you brush and floss your teeth? I'll let you think about that. So hopefully you got that right, is brushing your teeth at least twice a day, and then flossing at least once a day.
So patients with uncontrolled diabetes are twice as likely than someone who doesn't have diabetes to develop heart disease. Heart disease is kind of an umbrella term that encompasses coronary artery disease, high blood pressure, strokes, and heart attacks. The sugar can damage the blood vessels and the nerves that control your heart, and can affect the way that the blood flows through your heart and through your body. Your physician might use your blood pressure, cholesterol levels, and weight to assess the risk that you might have of developing heart disease. The best way to take care of your heart is to remember your ABCs. A is for your A1C. You want to make sure to keep it below 7. B is for blood pressure. You want to keep that one below 140/90. Some physicians might even have a goal of less than 130/80. C is for cholesterol levels. Some physicians might even prescribe different medications to help control your cholesterol levels. And S is for smoking. Stop smoking or don't ever start smoking. Next is chronic kidney disease. So as you can see over here in this visual, the kidney is made up of a bunch of different tiny vessels. And like we said, when your blood sugar is high, it gets into these tiny vessels and it damages them and reduces the amount of blood flow through the kidney. And our kidneys don't always work at 100% all the time, even in a healthy patient. They don't need to, it's just not necessary. But when parts of your kidney start to die off because it's not getting the blood flow that it needs, it'll eventually get to the point where it can't work anymore, and you might end up on dialysis, or even you might even need a kidney transplant. This does develop slowly and sometimes goes unnoticed without physicians doing lab tests. Next is diabetic neuropathy. This is where damage of your nerves, where your nerves cannot send the signals from your extremities to your brain. So most common is peripheral nerve damage. So that's in your fingers or your hands and your toes or your legs. Symptoms might include pain or increased sensitivity, which might progress to numbness and weakness. You might even notice foot ulcers and infections that won't heal, and bone and joint pain. So our next question is, what's one or two ways that you could find and treat foot ulcers and infections early? So hopefully you said just checking and washing your feet every day would be very, very helpful. Ulcers or cuts that go unnoticed can lead to some very serious infections. Some of these infections will require hospitalization and very strong antibiotics. If the antibiotics don't work fast enough and the infections travel, it's likely that you might lose the foot or even a leg, just because the blood flow isn't good enough, where the blood sugars damage the blood vessels too much.
And since you do need your blood flow to get to the area of infection, that's why it tends to spread, because it's not getting the proper blood flow to actually heal those wounds and cuts.
Absolutely.
So lastly, we just wanted to talk about the schedule of basically kind of what you're supposed to be doing, whether that's daily, yearly, every few months. So first, daily, you should be checking your blood sugar daily, at least once a day. Would be perfect if you are doing 3 to 4 times a day, with that one before you eat, yes, your very first meal of the day, and then the other 3, 1 to 2 hours after you do eat a meal. And then 2 is your feet checks. So making sure you don't have any cuts, or if you have cuts, that you are watching them to make sure that they are healing. And then the next one is physical activity. So you need to have at least 150 minutes per week, which comes out to about 30 minutes, 5 days a week. Or even if you're not exercising that much, you can work your way up to getting that total amount of exercise. If you want to start with like 5-minute walks here or there, and just gradually getting longer walks, or there's also classes that you can go to that may be covered by your insurance, and many different options for exercise. And then healthy eating. So I know we've gone over healthy eating in our previous videos. So that is something that you always want to be conscious of, whether it be cutting down on just little things, like say you drink 6 Mountain Dews a day. And so those 6 over time, that's a lot of carbs that you are taking in. So just maybe cutting it down to 3, having like 1 with every meal, that can help. So it cuts the amount of carbs that you had in half for a whole entire year, which is amazing. And that can help so much with your blood sugar and your A1C. And then lastly, for daily, you want to be taking your medications. Yes, taking pills can be very annoying, but they are beneficial, and sometimes if you do get to a certain point, you may be able to come off of some of the medications and not have to take as many, as long as you are doing the right thing for your body by eating healthy, physical activity, and all of that. So every 3 to 6 months, you'll have doctor's visits. You'll need to get your A1C checked. And then also you need to be going to the dentist. Some dentists say every 6 months, some dentists say yearly. So it's up to your personal dentist on whether how many times you get checked. And then yearly, you need to be having your flu shot, your kidney test, your cholesterol tested, your eye exam, your hearing check, and then a complete foot check by your doctor to make sure that if you've missed something on your foot check, that they get it. And then lastly, so vaccines are one of the safest ways to protect your own health. They are the best way to protect against vaccine preventable diseases. So the pneumonia shot is recommended for those with diabetes because you are at increased risk of death from pneumonia. So get a shot to help prevent that and not have to possibly have horrible outcomes from it. And then hepatitis B, this is one of the new recommendations. So it's recommended for people with diabetes because they do have higher rates of hepatitis B than other people of the population. And some Hep B actual outbreaks are associated with the blood glucose monitoring procedures among those with diabetes. So that's why it's always important to make sure you don't share your testing supplies, and also to make sure that you just get your shots and make sure you're updated. You can always go to your pharmacy team and ask them what shots that you need, and they can go through and make sure you are fully up to date. And then lastly, the as needed. So mental health checks are always good because sometimes, diabetes and depression sometimes can go hand in hand. So you always want to make sure that you are at the top of your mental capacity and you are doing well. And then last, any new symptoms or health problem evaluations. So if something does come up, you always want to be upfront with your doctor and your pharmacist to get on top of everything. So lastly, we just want to say thank you.
Yes, thank you so much for watching. And if you have any questions at all, there's plenty of other videos that we have. We have videos on portion control and sort of different things like that. If you have any other questions that those videos don't cover, you can always ask your pharmacist. Your pharmacist is always there. Thank you guys and have a great day.
Thank you.